This small ward in Meroe's main hospital is where Mohammed Eid has brought his elderly mother to be treated. He says she's suffering from nausea and diarrhea and fears she may have become infected with cholera.
I heard that the disease was spreading during this rainy season, especially where the water remains stagnant for 3 days or more and mixes with sewage and dirt. So when my mother got sick and started vomiting and losing fluids, I brought her to the hospital.
The disease spreads rapidly in densely populated areas with poor hygiene, and Meroe, once a small town, has become crowded with people fleeing fighting in the capital Khartoum. While hundreds of waterborne diseases have been reported since the start of Sudan's rainy season, the real number of those affected may be much higher due to many flood-affected areas being cut off from health facilities, and much of the rain and flood water is yet to be drained, raising concerns that more people will be at risk. But doctors here say the hospital is not prepared to handle a large number of patients and they lack basic facilities.
We may have cholera cases, but the hospital is not equipped to test for that. We can't separate the sample and test for the bacteria and put patients in isolation wards. The hospital is not properly developed, so we're not prepared to deal with an outbreak.
Mohammed Eid says while he has no way of knowing if his mother has cholera, he fears that as long as the rains continue, she could be suffering from any number of waterborne diseases. Hiba, Al Jazeera, Meroe, Northern State.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.